Hello, everyone. I'm Dr. Monica Malampalli, Executive Director of the Alliance of Sleep Apnea Partners. ASAP is a nonprofit advocacy organization very much dedicated to patient-oriented and is dedicated to being patient-oriented and patient-focused. Our mission is to promote and advocate for screening, diagnosis, treatment, and management for optimal health of those who suffer from sleep apnea. Welcome to the Breathing Room, an ongoing virtual series to discuss timely topics related to sleep apnea. This is our fourth episode related to this topic. As we have discussed before, the recall of the positive airway pressure devices is the largest recall to affect the sleep apnea community. To this day, PAP therapy is considered the gold standard treatment for sleep apnea, although other treatments have recently come into market. In today's episode, we will speak with frontline providers about their perspectives and their firsthand experience in providing care to patients affected by the recall. We will also hear from them on what steps could have been taken to improve patient care and what changes are needed that would make patient experience better. I want to remind our audience that this is not a live episode, hence audience participation was absent, but we want to hear from you. So if you have opinions and questions for our panelists, please feel free to write to us at info@apneapartners.org and share your contact info with us if you want our panelists to reply to you. So let me get started with introducing you to our panelists. First, we have Nicole Sonderman. Nicole is a board-certified clinical sleep health educator and a nationally board-certified health and wellness coach. As a care manager, Nicole provides one-on-one coaching to patients who are referred for CPAP-specific coaching by the healthcare provider. On a weekly basis, she hosts CPAP clinics to provide support to CPAP patients as they acclimate and adapt to the therapy. Nicole also serves as a board member for the Florida Association of Sleep Technologists. She has her own coaching practice and consults on all sleep-related matters. You can learn more about Nicole via her website called allaboutsleep.org. Nicole also serves on ASAP's Community Leadership Council. Hello, Nicole. Welcome to the program today. Next, we have Laura DeFleece. She's a former manager of the Connecticut Center for Sleep Medicine at Stanford Hospital. She started working at the Stanford Hospital in 1996 and moved to the coordinator position under the direction of Dr. Dominic Roca, medical director of sleep medicine at Stanford Health. Under his tutelage, Laura built a program from an apnea center to an accredited sleep disorder center, where she was tasked with overseeing the operations, building patient relations, and providing PAP therapy support. Laura is former board member of ASAP. Welcome, Laura. We then have Frank Salvatore. He's currently the systems director for sleep and wound care, hyperbaric medicine at Nuance Health. He oversees sleep centers in 6 of the 7 hospital locations within Nuance Health. Frank is a respiratory therapist and held many roles through the years, from bedside clinician to educator and leader in the profession. Frank served as the president of the American Association for Respiratory Care from 2015 to 2016. He has a unique perspective when it comes to sleep medicine because he was diagnosed with obstructive sleep apnea in 1995 and has been continuously treated since then with CPAP. Frank likes to tell people that he can count the nights on one hand where he did not go to sleep with his CPAP unit on since 1995. That's pretty impressive, Frank. Welcome to the program. And finally, we have Andre Puglio. He's a trained sleep technologist and worked in that capacity at the Children's Hospital of Philadelphia and University of Pennsylvania Health System until 2002. Since then, Andre moved into business development and product management of sleep-related medical devices and software. As a long-time patient with sleep apnea, Andre wants to continue contributing to the advancement of improved therapy and education for OSA patients. Sleep is his passion, and he's dedicated his professional life to helping others get the rest they deserve. Andre also serves on the ASAP's Community Leadership Council, and so does Nicole, in case I forgot to mention that. So welcome today to the program. So very delighted to have you. I feel like this conversation was very important and something that I've mentioned to all of you before. I think it's very important for the community to hear your perspectives as the frontline providers, because you day-to-day engage with patients, have been trained to engage with patients. So in your opinion, what did you see as the biggest problem? I'm going to start with Frank and then just go the way everybody is here on my screen. So Frank, again, what did you see this as, as the biggest problem during the whole, this whole time that when the recall started, and what you've seen since then?
Thank you. From my perspective, and it's both as a frontline provider and even being a patient, I think the biggest problem was the lack of timely communication between not only the the manufacturer and the sleep centers on equipment updates, but as patients, we all knew there was a recall that started in June of 2021 due to the foam, but we only got information in drips and drabs. There was never really a good outlet because Philips, I believe, in my opinion, gave us exactly what they were legally obligated to give us. But then they would say, call your durable medical equipment provider. And then you'd call your durable medical equipment provider and you'd get, well, we don't have any information for you now. Call us back in, a few days. And believe it or not, I still know some people out there today who are waiting for the follow-up because they did not take a strong advocacy stand on their own and keep calling. So I know people who have either stopped using the recalled unit or have been using it and thinking somebody would call me.
Oh, no, that is unbelievable that we're still seeing that. Laura, what do you, let's hear what you have to say again.
Well, unfortunately, I had retired and fully retired from the hospital in April of 2021. And this happened in June. So my director immediately called me, even though I wasn't in position anymore, because administratively, he wanted to know how we can help these patients. None of us knew at the time of the recall how the enormity of this or how poor it was going to be handled as far as communication goes. So he wanted to get a jump on that. And so he asked me my advice and what he should do in the lab now. And basically, fortunately for us, we did have the software, the download software, which is basically a database. And you're able to pull that up and see what patients you could start with, like the worst AHI, and go down the list, because it's all related to the home care companies that they belong to. So he was able to pull that up. I helped him do that and get letters out himself to the patients. So the hospital actually took action in getting the patients informed about it. My hiccup here is the registration process, because Philips waited for the patients to do that before they took action on anything. And so many patients still, as Frank said, don't have their machines, didn't get a new machine yet, which impacted on patient care. Also put a hardship on the doctor's offices and on the doctor themselves, because now you had a volume of phone calls coming in that they didn't have the staff to really manage. And the doctor was put in the hot seat for what to do for the patient. Do you keep them on a machine because they're so severe they really shouldn't be without it? The other options are not for everybody. An oral appliance is not for a severe patient. Positional therapy doesn't work for everybody. Weight loss is not a quick fix. So, it's now, what do? Do you keep the patient? If there's no indication that something's wrong with the machine, do you keep the patient on the machine? Do you take them off and have them see if they could buy another machine, which, as we all know, prices went sky high after that. So it was a very, very sad start to remedy this problem. And patients got caught in the middle of that. Doctors' offices could only do so much, and sleep labs only have, a certain amount of staff and what they could do administratively. But from my point of view, had I been there administratively, physically in the lab, I now look back and see how I could have possibly helped the patients get through that a little easier. One of the things I would think should be put into place is an automated registration system, much like we do with our vehicles. Frank sells a vehicle to me and I go and register that vehicle. Motor vehicle sends that to the manufacturer. They know I own the machine, own the car, not Frank. So I get the recalls for that. So we should have something in place with the home care systems. They have all the information on this machine they need, all the demographics on the patient. There should be a simple button along with everything else. Just send it to the manufacturer and not rely on the patients to do that themselves. This is medical equipment, not household appliances. And if that was done, Philips would have had everybody's information and the registration and the serial numbers, and they wouldn't have waited for patients to do that themselves.
Very good point. Let's come back to that again and discuss when we talk about solutions and strategies. But kudos to you and your team that you were actually able to quickly react, although under the circumstances that you had no guidance and not knowing what to do, but you were at least able to react and reach out to your patients. So thank you for that. Andre, let's hear your sort of take on this issue, because you are also working in the industry and you saw this sort of unfold, during all that time. And so again, as a technologist and as somebody who's, on the business side of things and as a patient, again, just kind of give your perspective on this.
Yeah, there's a lot of different perspectives I kind of have. I mean, the first thing we should all address is the unfortunate that this happened, but it also happened in the pandemic, where devices weren't available, replacements weren't available, and to replace things, everyone was delayed. Car manufacturers, chips, to get up and running and to replace things as a manufacturer. I'll take that hat on for a second. There's a lot of challenges, even just meeting up with the daily demand, and then you bring in a recall. It's really difficult to kind of replace everything during that pandemic time. At the same moment, I agree with Frank, is communication. FAQs, what should you do if this happens? If you're a physician, you take this step. If you're a technician, you take this step. We're also in an environment where obviously sleep labs and physician offices aren't always delivering the CPAPs. There's always a DME. So there's different layers of communication. Patients don't really know the science about it, but I think a lot of physicians and technicians really know what was actually happening. Not so much was just a filter or what caused it. So there's that part of the education. And I can speak for myself and my father. When this occurred, we kind of had our hands up in the air. It's like, okay, what do we do? And I think everyone mentioned is you could call your physician's office, but they didn't have the answers either. It's hard to react to something that was so drastic and affected millions of people. There's millions of CPAPs out there. And I agree with Laura, having a registration system across all medical devices, that especially devices that go into patient's home, to be able to track that and have communication. When you buy medical equipment and you're a hospital and there's updates, those things are pushed out. There's automatic updates. There's you get emails, you get all this information from manufacturers and feedback from patients. When a device goes into a home or it's a rental model, because that's also enough, the DME may own it and they rent it out month by month. Tracking patients is in different levels, either at the manufacturer level, DME level, and the physician and sleep lab level. So there's a lot of challenges that were in the communication, and I don't think everyone knew the answer in the first year of what can you possibly do or how severe it really was, until time moved on and the severity on how it was injuring patients, and then the lack of therapy that severe apnea patients needed to have. Once a patient found out, they just stopped using it. And then what is their alternative? Obviously alternatives, we could talk about that later, take time. If just getting another CPAP, there wasn't enough supply to meet the demand from other manufacturers. And then alternative therapies, they take time also. You have to get another study, get evaluated for different alternatives. And that means usually office appointments, sleep lab appointments, and that really backed up the labs and the specialty offices.
Yeah, no, thank you for that. I think, again, this is something I've heard, repeatedly. Communications was one of the biggest issues through all of this. And then again, how we were all taken by surprise within the sleep apnea community when this recall happened and not knowing, again, what to do. Nicole, you have a very unique perspective as a sleep coach. And tell us about your experience and sort of your perspective on this recall.
When I got into sleep medicine, my goal was to be a liaison between the public and the medical community. And working in a pediatric hospital, I had parents and patients who were on the equipment. the recall happened, they called me and asked, what do we do? What steps do we take? And whether it was a patient I was coaching or a patient who we just recently diagnosed, we told them they needed the equipment, and now they're told they can't use the equipment. And it went beyond that because a lot of the parents were on CPAP as well. And a lot of those parents would run the risk of losing their license or their job if they didn't use it. So it was twofold. A parent had to make a decision on, do I treat my child with the CPAP or do I not treat my child with the CPAP? I mean, that could be a life or death position for the parent to be in. And then also for themselves, do they use the equipment or do they not? So as a coach, it was difficult. And as their clinical advisor, it was difficult to tell them what to do. So I followed the AASM closely. I attended the webinars, learned what I could, and then I referred patients to the resources that I knew were good. And that's what I love about ASAP. It's a good resource to refer people to with updated information. And we also did something different. We sent them to YouTube. And there were several sites, YouTubers in Australia, that were showing people how to take the equipment apart. So if the problem was just foam, then if someone knew how to take the foam out, they could, and then just use the equipment and it was loud, if that was actually the problem, because at first we weren't really sure what was going to come out next. And were other distributors also other manufacturers also going to have that problem? We didn't know. So I agree with everybody about communication. I think reaching people is key. And it's very difficult without a general database. And people would need to go to a site to register their equipment. The DMEs all have their own lists, but I know whenever we would get a download, if they weren't linked, I was calling the DME, and then there were 2 or 3 steps involved just to get a patient download. And so I think everyone's responsible for maintaining a database of equipment. And I know from our end, the hospital sent out notifications to our patients that were at risk. We didn't have current addresses sometimes because some people, they weren't recording information that we needed. So if they moved, we didn't always get their updated address. So it's hard to ask for this on a national level. It's a huge ask, but I think it would be so beneficial. And to have resources available to patients, so when they do have questions, they know what their choices are and they know what their options are for other therapies. So I'm in agreement with everybody.
No, thank you for that. And I think, again, patients were left not knowing what to do. People like you who are dealing with patients every day had that issue too. And what you're telling me about the foam and removing it from the machines, I mean, that's sort of, to me, a very drastic step. And now, telling patients how to do that, it's like, going into your machines and changing out the foam or removing the foam is, again, sort of an extreme thing. But again, I understand the concerns and not wanting to, not wanting to use your machine with the defective foam. So again, so the next thing I want to ask is, how did this recall sort of impact your day-to-day work life, right? After the recall happened and the people that you were interacting, Nicole, you have actually, already mentioned some of that. But again, being in that hospital practice and dealing with, again, patients and caregivers, I would love to hear from Frank, Laura, and Andre. And then what were your primary concern now dealing with patients, and what were their primary concerns? I will tell you, in the past conversations, trust came up as one of the biggest issues now. So love to hear your input. Frank, let's start with you. And then,
I mean, I have to tell you, from the start of this, one of the biggest issues that came about from the treatment side, from the center side, was that the medical directors didn't know how to handle the information that was being given to them. You could either continue to use the device and put an ultra filter on the outflow so that if there are little pieces of foam being spit out, it catches it, or you can just stop using the equipment. And we had medical directors, and again, I have, 6 sleep centers across 2 states, and each medical director had a different idea. And in the end, what we ended up doing after working with our legal department was we found that some of the centers had non-recalled units. And what we did was we took the recalled units out of service, but then had to place the units that were, quote, okay, into the 6 centers. So if I had a 2-bed lab in one center, I made sure I had at least 50% covered in one unit there. 4-bed labs, I tried to get 2 units, and I'm my 6-bed, which I have 2 6-bed labs, tried to get at least 3. Didn't always work. So sometimes I only had 1 or 2 in every center, and in a 6-bed lab, 1 or 2 CPAP units really hinders your ability to get patients who are diagnosed as being positive for obstructive sleep apnea and needed to go on to have a PAP study, waiting a long time to get in. And we didn't always have the ability to do emergency splits on people because they weren't in a room with a PAP unit. So that was my issues, and I'd love to hear what the others have to say. So I'm going to stop there.
Sure. Laura.
So, obviously there was always the, your lab is either going to be set up Respironics or ResMed. So fortunately there was ResMed that they were able to go to. The thing that I think bothered me the most when, I had patients calling me up, and I had the doctor, Dr. Roca calling me up and asking me questions. And the thing that bothered me the most about the recall was that they took it all the way back to the system ones, which began in, I think, if I remember right, 2006. And a lot of those machines were replaced by the Dream Station, or they were over 5 years old and replaced by other machines by this point. So I think that I don't know why they recalled so far back. I actually, and Monica, you've heard this story. In 2019, I had 2 patients back to back, a woman and a man, that came to me and showed me their machine and wanted to know what they could do about the filter. And I took the first filter out, and it was totally black. I mean, really like charcoal black. And I said, well, you got to replace this more than you are. What was the last time you replaced it? And he said, I just got the machine a week ago. So I knew there was a problem. And I called the home care company, and I actually took pictures and showed them the filter. And they replaced the machine with another one, and it was fine. And the guy moved on. Same thing with the woman. It was 1 day, and the filter was totally black. So I knew there was something wrong with the Dream Station machines. And I reported it to Philips, I reported it to the home care company, and they replaced the machine. The woman was okay after that. So I expected this to be a serial lot of machines. I didn't expect it to be so massive. That made a lot of issues for a lot of patients, because they had machines, secondary machines in vacation homes, and just travel machines. And so it was very difficult for them to deal with. And I wasn't there at that time, but I think the decision of keeping on a machine and not using one was probably the hardest thing for the patients to do.
And you're right, Laura. Now we've heard that the issues existed even before, and something that the company did not divulge, and that's why I think there was more scrutiny on some of those practices there. But just again, for you and for actually Frank, I mean, your hospital was even dealing with the ventilator issue, right? So this is just even a huge, much larger impact on the hospital system.
Yeah.
And again, probably different approaches
Right.
in treating
I
these
will say to that, Monica, I don't know about Frank, but I can say this because I had to do it during COVID. I was still there when COVID started, and I worked all the way through till April of 2021. So I was utilized to get other to secure other bilevels when the ventilators ran out. So the hospital did have a supply of, for the floor purposes, they did have a supply of ResMed. So there was an alternate machine for them to go to.
Mhm.
Yeah, and I was lucky. I wasn't in my current role when the pandemic hit, but we had pretty much primarily ResMed machines, so we didn't have a huge issue in the in the hospital in the respiratory realm there. But my sleep lab had the recalled unit, so of course we had to deal with it there. And of course we're going through a pandemic where we needed those, we believe it or not, needed those PAP units in the hospital. I couldn't even, shift one or two over to my sleep lab to keep that area whole. So it was definitely operationally a nightmare.
And let me again just stay on this topic just for a bit, again with Frank and Laura. Did you run into issues where people were canceling appointments or not wanting to come in and get sleep testing done just because of what they were hearing, because there was a lot of misinformation, or again, a lot of information that they were not clear about, not wanting to get diagnosed, or hesitant to use the machines? Anything else that you had noticed that might have happened right after the recall?
For us, we were totally transparent with the patients when they were coming to have a PAP study, and we gave them the information that was necessary for them to be able to proceed forward. I had very few patients who had said, no, I'm not going to go forward with the sleep study, especially since they had to sign a document. So our problem was the number of people calling the sleep center because they just couldn't get the information elsewhere. So we had to actually kind of create a frequently asked questions list for those who answered the phones so that they could help answer the questions, because we would just need one full-time equivalent just to answer the phones at that time. But we didn't really lose a lot of studies.
Okay.
Yeah, I think the same thing from what Dr. Roca was telling me is that the new patients weren't so bad because they didn't know anything about this or the process. So they weren't through it yet. So this was new to them. It was the existing patients that had the issues, because especially if you're telling them to take the machine away, I think it leaves a feeling of concern over being told that you have to use this. It's, life-threatening disease, and you have to use this, or you're not going to breathe properly at night. It could cause heart attack and cause stroke. And then all of a sudden it's okay, don't use it. And I think it kind of like lost the importance of it to some patients that had questions over why they were being told it's so necessary. And then all of a sudden, okay, don't use it anymore. It's more dangerous to use it. I think it kind of was confusing to a lot of patients, and that had to kind of take time for it to smooth out too. So I think that the new patients didn't have as much of a problem as some of the existing patients had, because what else could they go to if like Andre said, there was a lot of things other things they can go to, but it's not for everyone. And it's not for every level of apnea. So I think it was a very confusing time for the patients for quite a while.
Definitely, for sure. Andre, what's your perspective, again, coming from the industry? I mean, you already said there were not that many alternate options. I mean, good, ResMed did step up. But again, what were the other concerns? We've seen subsequent recall again of, the magnets. And again, there were just a lot of other things that happened. So that put even more burden, on patients in a way. And again, this whole thing about, the confusion of, okay, one more recall or one more, it's just like it kept going. So again, what was your sort of thinking through all of this and watching what was happening?
Well, I guess from an industry wide, I think everyone, we're talking to each other, discussing what options are available. I think all of us have seen some people have capitalized on this. You'll see a lot more commercials out there for alternatives. The education has become greater out there, and awareness. I mean, I don't. It's awareness of how to take care of yourself.
Mm-hmm.
Family members really they just did whatever the doctor told, and that was kind of it. So I think a lot of people kind of do that if they're not in the healthcare industry. And this prompted them to go online, look for some questions. My phone was ringing a lot. Everyone's saying, what should I do? What should I do? And we didn't really have all those answers at the time, and still struggling to get to a point where everyone's going to get treated. And industry-wise, it's something that's unfortunate, and with the unavailability of other devices, they're comparable. Instead of getting surgery or doing something else where people are comfortable, everyone they could keep their interface. So that's the one thing that was that people liked, is they didn't have to get rid of the mask. And as you know, those are one of the three things that really make people compliant, is the pressure and getting comfortable, but actually having the interface. So they were able to, you could keep that part, and they felt a little bit of relief. They just needed a machine to give them that kind of treatments.
Well, thank you for that. Nicole, what was your relationship? Again, let's talk a bit about that. And what was sort of, again, your day-to-day, work with the patients. And even today, how is that, panning out? Are you still talking about the recall with them? Are they still coming up with concerns and asking you questions about that?
They are. And out of every negative can come a positive. A lot of other companies were able to now bring their products to market. And there were a lot of customers ready to buy. So as one product became unavailable, now people had the chance to promote theirs.
Mm-hmm.
So I was glad to see the innovation there, the opportunity for that. The questions that the patients asked, a lot of them came from what we told them as clinicians, which was, you really need it, and here are all the reasons why, and this is the value. And once the patients started wearing it and using it and feeling better, they saw the benefit. And it was hard for them to make that decision. Do you use it or do you not use it? And as a coach, my phone rang a lot. I know at the hospital it did as well. I think a lot of people got involved in helping. And I saw a lot of the community coming together. People used to talk about their mask. What mask do you like? Not so much their pressure, but their mask. Mm-hmm. And then it became a conversation of, what did you do? How are you handling it? We do 2 events a year where we bring people in the community together just to talk about their sleep experiences. And it's still brought up. We call it Sleepy Saturday. It's spring forward and fall back. And you still have people gathering, talking about what happened and what they did. So I think it'll be an ongoing discussion, and it created awareness and opportunity. And I found that you could have probably hired another full-time person to work in a busy sleep lab, just to field the phone calls and provide the right information and support. Even if we didn't have an answer, we could direct people on where to go.
So no, definitely there's a silver lining to this. And I think a couple things that you pointed out, people are talking about it. There's innovation happening in the space. I mean, again, CPAP was considered the gold standard treatment, but, we want to give more options to patients, because again, and also making that decision, if a recall happens, what can patients turn to? What do they need to do? So in a way, I think when it comes to patient care, clearly, I mean, this whole recall process, we've seen that. I mean, the patients, the end users did get impacted. And when all of this was happening, I don't think, even when I started the conversation, I kept thinking, where are the patients? Where are their voices, or where are the concerns we need to hear? So what did you learn when it came to patient care? I mean, one thing for me was how complicated and convoluted the whole process of delivering healthcare was to sleep apnea patients. You have the company that, interacted with the DMEs, and then the DMEs interacted with the patients. And it's just and then the doctors sort of fell out of loop. Like the whole thing was just so convoluted and complicated. That's how I saw it coming, looking at it from outside. So I want to just get your perspectives on that. I mean, again, what was that? And I'll combine it with this other question too. Again, as providers, how did you think, how are your community of frontline providers were effective in mitigating the impact of this recall? So what could have been done better, which we've sort of, again, talked about, but again, let's look forward, right? And what are the things that we could see could have happened before? Because there's no guarantee there could be another recall. But if that happens, what do we learn? What have we learned and what can we do quickly? Let's start with Frank. If you want to weigh in.
What could we have done differently? You know, this is going to sound weird, but I think what this recall showed is, you know, as we outsource more and more of the manufacturing of goods, you know, getting parts and stuff become very hard. And here you have a recall that happened, what, about a year and a half after a pandemic, okay? And, you know, we learned that we couldn't even get N95 masks to wear inside the hospital with pandemic patients. And then all of a sudden we get this recall. And the companies, they can't manufacture enough to begin with. And on top of that, because they're not manufactured here, parts might be, but they got to go global to get the parts. You put that in with the I call it, you know, remember that movie, The Perfect Storm? Okay. This was the perfect storm. We had a recall come in the middle of a pandemic, and now we couldn't get the parts. We couldn't get the pieces. We couldn't get supply. It became a big issue. And, you know, it almost, you know, it almost says, you know what, we've got to start standing up and saying, you know what, we need to manufacture this stuff in the United States. We need to be able to supply our healthcare population with the goods that they need. So I think that was one thing that I think needed to be done differently. And I also think because of the communication issues, you know, from a patient perspective, I used my profession to help me to get my CPAP unit, right? I knew enough to keep calling my durable medical equipment provider, but the rank and file patient didn't know that. So the guidance for them wasn't there. So, you know, something like this, there's got to be a way to push the patients to be more advocates for themselves as well, because they sat back and waited a lot. And that's because there wasn't a lot of communication. So that goes all the way back to the first question. So I'll stop there and let the other panelists talk a little.
Laura?
In retrospect, like both Frank and Andre said, it was a difficult time because of the pandemic too, and there were things that weren't available, and the other manufacturers weren't ready to take over and get the stock that they needed to help get machines. I think one of the things about having the AirView and the Care Orchestrator programs was that, as I said, being databases, you could look at that and see when a patient went on the machine and how old the machine is. I think what I probably would have done had I been in place was I used to have the home care companies come into the lab to place the machines. Once we went through the contracted Medicare stage where they were contracted with certain companies, a lot of the home care companies had depleted their therapist force. And so they were short-staffed as it was. And that was another thing we had to deal with during that time, because they didn't have the staff on to go to people's homes the way they used to. So what I had done after that, when that went away and they went back to people could use anybody they wanted, I had the therapist come into the sleep lab and deliver the machines there, so that they would take a day, and whatever day it was. I think I would have asked them to come in and check the machines. So there was an extra hand, an extra eye on that to see if there was anything coming. You could put another filter on the outside of that and to see if anything was coming out. And if they felt they were safe enough and let the doctor think they were safe enough, maybe we could have kept more people on machines through that process. Or done something more for patients, that there was somebody else there trying to help them, not let them feel so dropped, or that there was no place to get an answer from. I think probably would have done something like that, is to get the home care companies a little bit more involved and just have another set of hands there to help us get these patients through this time. Physically, I don't know where you would have gotten machines from.
Yeah.
And I would have let the ones that were over 5 years that actually could have been replaced by insurance again, gotten them on the ground that way, trying to get the machines for them so that they would be not part of this whole thing and not have to worry about waiting for a replacement machine.
No, thanks, Laura. Andre, what's your take on this? I also want to have you talk a bit about, it's the foam that was the issue. The machines are fine. The machines are very simple the way they work. Is there even a talk about, and we know that there are these two big companies, they were using different foams, and now of course Philips has switched the foam and went to silicon-based foam, which again, we don't know much about that either. But again, give me your opinion on this. What could have been done differently? I mean, again, what Nicole was telling her patients was sort of the extreme end, with, changing the foam out themselves. You're now actually, going in and tampering the machines with. But what could have been, again, done differently? Again, coming back to, was that foam necessary even, because it's for the sound? But let just, share some thoughts here on, what you think.
Well, I mean, first of all, I think the foam is definitely absolutely necessary. I'm sure most of us remember when CPAPs were louder than trains, and the bed partners couldn't even stay in the same room. Snoring wasn't even as bad as sometimes some CPAP machines. So you want a quieter and a better machine. I think I'm speaking for myself. Obviously, I'm not a manufacturer of CPAP devices. Is a recall or a repair, something I think Frank was mentioning, a simple repair or a process where you could bring your machine in and maybe you don't have it for a week. There's something maybe a DME could do the process of fixing it. Getting into the details of it could take more time, of course, and getting FDA approval. But I think we always come back to communication is, okay, if this happens to you, if you have serial number XY dash whatever, then this is who you should call, and this is how we can fix it. And if not, then we'll have to issue replacements. And Frank's perfect storm, it affected more than just CPAP machines. It affected everyone's lives and everything that we were trying to get done. And the timing of it was obviously unfortunate. But it did. It's something that I think the education parts would be extremely helpful. Just a dedicated web page that said, "Here's all the problems. Here's how we're addressing it, and here's who you should contact for some resolutions."
Yeah, I think all of that was done. I think, initially it wasn't, but I think Philips eventually did put up a lot of the, communications on their website.
Right.
FDA had information, which again, a lot of people didn't know to look.
I think what it also did is it actually helped prepare a lot of other manufacturers. Look at their regulatory, look at their contingencies, look at their instructions for use, and take a double take on, maybe we should think about this ahead of time. I don't remember in my lifetime something this drastic happening in any specialty that affected millions of people. I don't think anybody was prepared for it. Even with questions, answers, supply, solutions, no one was really prepared for something on a grand scale. And I think other medical companies, not just respiratory, but all companies were kind of looking at their policies and making contingency plans. What happens if XYZ happens? Then we should do ABC. And I think that I've seen a lot more preparation from Repironics, preparation for the future, and from ResMed, Fisher Paykel, and that's just a small part of the healthcare community that's kind of thinking, what if a recall happens during a pandemic? It's all the worst case scenarios, and I don't think anyone can be completely prepared for such a massive impact on healthcare. but just having a plan in place would be really useful.
One thing you did mention is the repair. I think DMEs already are so burdened with everything. I mean, is there a possibility just to think about, places that people could have taken their machines? I mean, we don't have anything like that existing at the moment. Yeah, Frank.
Yeah, well, Andre said repair, and I'm sitting here saying to myself, repair. The manufacturers set up their own perfect storm. When something goes wrong, you got to get a new unit. We've become a disposable society, right? So we get a TV goes bad, you can't, there's no repairman anymore. They come, you go get a new one. And I think that's the problem with the PAP units. There was really not an ability to get inside the unit because they're sealed units to go and do much repair. Now, could you get into the unit? Absolutely, you could, okay, because they had to close it up somehow. But we created a disposable society, so these manufacturers already set it up that if it fails, you need a new one. Then you get a recall like this. There's not much to be able to repair. They don't have repair stock because they've already set up the paradigm of saying you need to get a new one.
If I may, Monica,
Yeah.
Andre said something that also hit a chord with me, is the insurance factors on this, because a recall, the manufacturer is responsible for replacing that machine. But unlike a recall on pharmaceuticals, if your medication gets recalled, you can go, your doctor can order another medication similar to that, and you can go to the pharmacy and get it covered. That's not the case for the criteria for insurance coverage on CPAP is very different than on other medical equipment or medications. So a lot of this had to either come out of the patient's pocket to replace that machine. So maybe we have to look at exceptions to crisis like this too, where patients would be able to get coverage, because a lot of patients would not take money out of pocket to replace the machine, especially when the price is doubled. I mean, that was ridiculous. So there's those factors too that the patients had to deal with.
Mm-hmm.
And maybe that should be looked into too.
No, absolutely. This is great. Nicole, I do want to give you a chance if you want to add anything to that conversation, but I also wanted you to weigh in on some of the risk management for employers, and sort of we briefly, you and I discussed about that aspect of the risk management. It's something that we've spoken about quite a bit, in other places. So tell us a bit more about that.
When I had patients call and they were asking about using the equipment or running the risk of losing their job, the recommendation that I made was for them to speak to their managers, to their HR department, employee health, and just explain the scenario. It was up to the company, like the truck driving industry, the leadership within organizations, to then make decisions on, are we going to look at the download? Are they compliant? Or are we going to put out a notification regarding CPAP and the employees? I really like, Andre, when you said about the service. Maybe that's an option for the future. If something like this does happen, have a plan B, and not just empower the patients, but empower the employers. So say you work for ABC truck driving and you're a firefighter. Let those institutions assist the CPAP patient with a plan. So you're using the equipment because you need it. You have to stay compliant. So you stay compliant at work. Let the companies get involved. And then the insurance cost won't be as big a burden as it initially was for people that have to use it for work. Maybe their EAP program can have an extra plan where you send the equipment in and get a new one, or have it at least evaluated. Mm-hmm. But it was a big factor for first responders, airline pilots, truck drivers, school bus drivers, and they had to make some big choices. And I think having the option of corporate standing behind you, it eases the burden on the patient and on the medical system.
So Oh, so true. Can you also talk a bit about the sort of the emotional response, right? And sort of looking at all of this, because you were again talking to the kid, to the parents, about their kids, and talk about that aspect, because in all of this conversation, I think we've missed that aspect, looking at the patient, really what they were going through day to day, right? Because we're so focused on the processes. So Nicole, just tell us a bit more about what you were experiencing when it came to that.
Trust and fear were two of the biggest emotions we had to deal with, two of the biggest issues, because we do a sleep study on a child, tell them how important it is, they need their equipment, they get the equipment, a few months later, we're telling them, sorry, you can't use it. That was hard. And how do you explain to a parent the exact opposite of what you told them months ago? And the fear of what next? In 2009, when I started this, no one ever thought a piece of equipment would fail. We were dealing with mask issues. And do you want to go to the slumber party? Will you look like a funny kid with a CPAP mask on? And we would get the children to embrace that. We never thought that the machine was sending something through the mask. That was the biggest concern, not a social issue. Like, it's not sexy. And so there were so much fear and distrust and unknown. And it wasn't just this one issue. It's what could happen next. So it's preparing people and having a second plan in place. If this, then that. The magnets with the mask, we knew that. When we fitted a patient with a mask, we asked them, do you have a pacemaker? Does the person you sleep with have a pacemaker? Like, that was a known for a long time. What I love seeing now is that it's out in the public. And now the public can see that information. So they can say, oh, yeah, that's all right. I can use the magnet. Or, oh, man, I didn't know. Yes, let's look at a different mask. So bringing information out gives people more trust in the industry. And it gives people more trust in the people that they're asking for guidance from.
So really transparency too in all the
Transparency.
communication. Yeah. One of the things, one topic that came up in prior discussions, even with the patients, were they're concerned with long-term effects of, using these machines, because at one point they were told, keep using it, and they were still breathing in these particles or breathing in this air. But we are not in any way prepared to monitor those patients or think of what the effects of this might be for them in the future. So Frank and even Laura, like, have you heard anything, at least from your hospital systems, on conversations around this? Because, or are there any protocols or anything in place now by the hospitals? One, if a recall such as this happens, what would they do? Plus, there's going to be more and more patients coming up in the future having complaints of breathing issues or any other problems. To begin with, also, a lot of sleep apnea patients have other comorbid conditions that could get exacerbated, right? So I just want to get all your thoughts on this topic.
Again, you're obviously you're going to have a long memory about this being an issue, this being the recall going down the line. I have the pleasure of most of my sleep doctors are also pulmonologists too. So, they're in tune to changes in the lungs and stuff like that. So when the patients come to them and say something, they, may think, okay, this is an outside chance, we'll do this. But, for the future, I think, my health system really took a proactive stance, looked at the data that was out there, and made a determination. I mean, we were very ultra conservative. We took the units off of the bedside stands, and we moved ResMed products in. Even the magnets. Our doctors pulled all the masks with the magnets, because there is, and again, somebody tried to explain to me the risk with the magnets, and the magnetic field is so small, but who wants to take a chance? right? You never know. So, we continue to watch for things like this. As soon as we get something, we have partners in our legal department. We'll sit down, we'll look at the stuff. The medical directors will sit in on it, and then we'll just make decisions from there and be very transparent. We don't, we pulled the equipment out, we pulled the magnets out, that fixes it. But we still got patients out there that will not give up their masks with magnets. They would not stop using their PAP unit because, I kiddingly say since 1995, I can count on one hand the times I didn't go to sleep with my PAP unit. That's because when I do go to sleep without the PAP unit, it's the worst night's sleep ever. So once you do that, you want to keep going. So, we got to keep working.
Are you capturing some of this information? Like, is there a way for the hospitals to make a note that these patients have these machines or were exposed to, the VOCs or the volatile, compounds that the breakdown gave? I mean, is there a way that you're keeping track, at least on the hospital side, if these patients do come back and with some of their health issues? I know that's asking for a lot, but
well, it's probably documented inside the body of the notes, particularly in the sleep physician's practice notes. But we don't have a database that this is a patient we saw who has it. We don't, we haven't gone that far to create something like that. We've left it to the practices and we've left it to the durable medical equipment companies who should have also those records as well.
And this is something I think definitely for advocacy to patients to keep notes on some of these things and share, every time they go back to their doctor. Anyone else wants to weigh in? Laura, you want to add
Well,
anything?
we were really fortunate that the pulmonologist that ran our sleep center, the sleep center and the doctor's office were all in one department. So we had everything right there that was needed to look into all this. And there was close follow-up with patients to begin with. I mean, we saw patients outside of insurance criteria, on an average of, like within the 90 days after starting and 6 months after that and a year after that if they were doing well. So we had very close follow-up on patients, and so clinically would be watched to see if there was any changes in their medical conditions. And I think that was one thing. But outside of that, I don't know what else could have been done except for just, ask the patients that if anything changed to come in, if there was any changes, to call or to come in and see a doctor.
Mhm.
That would be all I could think of.
Andre?
Well, actually, the hospital EMR systems are really robust. And those EMR systems can talk to manufacturers' equipment. They do only every day, ventilators, EEG machines, sleep machines. And many sleep labs have databases. Within those databases are tracking what's their past AHIs, what kind of mask are they using, what was their pressure, and what's machine are they used. If you can open up those EMRs to have portals for DMEs. So sometimes these EMRs, of course, you're worried about HIPAA and not getting too much out, but having things like I use like ByChart for my own medical history and see what's going on. If there was a portal for DMEs to see what sleep labs can share, then if they send out a new mask, if they send out a headgear, if they have a CPAP in the field, use that sleep-specific databases to track it. Now, there's a lot out there that are really, really robust and tracks everything, and it's automatic. And once it's into the sleep database, it automatically goes in the hospital EMR in different fields that are selected for that. I think that's the kind of information that's extremely important to be shared on our treatment side, on our provider side. That even a national database to have some kind of, the VA has a national database for all their patients. Now, it's not national healthcare. We could talk about that for hours and hours, but even the sleep lab or AASM kind of database where people can use and share. And this will also help share information. for anything else that may come up, a new drug, a new surgery, a recall, or whatever it is. So it's definitely information and information sharing. The data is there. It's there somewhere. It's a matter of getting it out of the machines or providers and putting it into a localized location where people can access it.
Thank you. Nicole, do you want to add anything to that discussion?
I agree that there should be a national database, and not everyone gets their CPAP machine from a doctor. They buy them online. They get handed down their CPAP from a friend, a sibling. And if they wanted to register their CPAP machine online, it would be fantastic if there was some central spot where they could do that. And if you could link the different DMEs to that spot and let them upload the information, and the EMRs, if that information can go, even if it just has a number, if they didn't want to put a name because of HIPAA. If there were a national registry, it would be so easy to get information out to people. And it's just, someone needs to control that.
Okay. Well, these are all great suggestions. So and I can't believe we're out of time. But again, as the last question, what is one message or one action you want our audience to take away from today? Frank, let's start with you.
Advocacy. You need to advocate for yourself. You learn what's going on and then take a stance and make sure you follow through. Don't wait for somebody else to tell you this is what you have to do. Be proactive. That's
a great message. Laura?
Accountability and support. That you can't just pass it off and say, we'll call this one and call that one, call that one. You got to take a stance. You got to help that patient in some way.
Andre?
Along Frank's is education, self-education. Make yourself more aware of what's going on in your own healthcare, what medications are you taking, what devices are you using, what diagnostics are you using. I think too often we're looking at our watch for all the answers in the world. That's not the answer for everything, but educate yourself and don't be afraid to ask questions. Even though everyone's busy, your healthcare is first, and you ask questions and get the answers you need.
And Nicole?
Education and advocacy, letting people know that they're not alone and giving them a resource, a place where they can get information, ask questions, learn, and become empowered and take care of their own healthcare.
Great. Well, thank you all for those insights. And, I just want to say, first of all, I want to thank you all for the engaging conversation today. I think we've learned a lot. We've definitely discussed, some solutions in our conversation today. So thank you for being here today. So in just closing, I want to say this work is supported by the American Academy of Sleep Medicine Foundation. Any opinions or recommendations expressed in this episode do not necessarily reflect the views of the foundation. To our audience members, if you want to share any stories related to the recall, please email us at info@apneapartners.org. You can also write to us if you have any questions related to the recall or any issues you're having that we might be able to help with you. And that includes also questions for our panelists. I encourage everyone to sign up for our newsletter so you can stay connected with us. Follow us on social media, Facebook, LinkedIn, Twitter, or X, and Instagram, as well as YouTube. We will make the recording of this webinar available to you soon. So on YouTube, where you can check out all our previous episodes as well. Thank you for joining us today, and see you again soon. Goodbye.
Bye-bye.